This is Katie Taylor, and you are listening to episode 2 of the Child Life On Call podcast. Hi, and welcome to the Child Life On Call podcast. When your child is sick, the whole world seems to stop in its tracks. Plans and priorities change, and your number one job becomes figuring out how to get your child well again. For some of us, rest, medications, and relaxation can do the trick. But for others, it takes more. It takes countless doctor appointments, invasive medical testing, therapies, surgeries. The list goes on. And then you still may not have all of the answers or results you were hoping for. This podcast features parents of children that have an illness or medical condition and gives them a place to share their own journeys and experiences. We will talk about the ups and the downs, the highs and the lows, but one thing seems to remain the same. Children are resilient and teach us more about ourselves and the world than we could ever imagine. Thank you so much for lending a listening ear and opening up your heart to these families and this podcast. I'm your host, Katie Taylor.
So funny because I asked her, so on that last day, I said to her, she said, I said, I've had this question all these years that I've always been afraid to ask you. She says, you can ask me anything. I said, what was it that made you come into the emergency room all those years ago? Because, pediatricians don't do that. Mm-hmm. House doctors are there. I said, I said, I don't understand. I said, everybody was telling me I was crazy. I said, what was it? And she said, honestly, she says, the words that a mother will say, something is wrong with my child.
Guys, this episode, I want to warn you, I say, oh, wow, a lot. I say, oh my gosh, a lot. Within 5 minutes, you will feel like you've known Michelle for your entire life. You will feel her pain as she discusses the unknowns of her daughter's acute battle with meningoencephalitis. You'll want to cheer her on as she describes being an advocate for her daughter and fighting for what she believed in based on her motherly instinct. Michelle brings a unique perspective on relationships with healthcare providers, given the fact that she is a nurse and has been for over 18 years. You'll hear her talk about the benefits of building a trusting relationship with your child's pediatrician, and she gives great advice about how to find that specific provider, and also talks about the importance of following your gut instinct. Michelle's story is one that took place 15 years ago, and this is the first time that she has spoken about it publicly. You will fall in love with her. And besides being the easiest person to talk to on earth, she is kind and humble and incredibly brilliant. She was an engineer for 10 years before she answered the calling to become a nurse. It only makes complete sense that her offspring is going into the Air Force Academy. Totally impressive. Michelle, thank you so much for being here today, and we are honored that you want to share Brynn's story with our listeners. Michelle, why don't you start off by telling us why you have decided to share this story and a little bit about you and your family and where you guys come from?
So the story is about 15 years old, and I think that now is the time that was almost perfect timing to want to share it, only because I think maybe somewhere in my words, somebody might find something that can help them on their journey. I know along the way I had people that would say just things in passing that somehow really stuck and helped me get through it. So that's probably why now I've, decided to talk about what we've been through as a family. I'm the mom of 3 girls. And my oldest one, and maybe coincidentally, it's because she's getting ready now to embark on her own life. She's 18. And, there was a time we didn't think that, she would make it to her next birthday. So hitting 18 was a real milestone for us, a real sort of like I can exhale moment.
Right. And not only hitting 18, but like hitting it and rocking it.
Yeah, absolutely. She's definitely, when people say, oh, the teenage years are the worst, I have to sort of be quiet because for me, they were almost the best. I watched my daughter bloom into this really strong, confident, focused, she definitely knows what she wants to do in life. So I'm going to unleash her on the world.
Do y'all know what it takes to be granted admission as a cadet into the Air Force Academy? Well, let me tell you, it is no easy feat. In addition to requiring a way above average GPA and test scores, you have to be a well-rounded individual with drive and persistence, and above all of that, you must be appointed by your state senator. The daughter you're listening to Michelle talk about today has done all of that. Oh yeah, and she's been recruited to be on the Air Force Academy's women's volleyball team. So now that you know this story has a happy ending, I'd like you to pay attention to Michelle as she takes us back to when Brynn was a toddler and the first signs and symptoms that something wasn't right.
Yeah, it's funny that, when you, in life, this is a story that I feel as though somebody painted it in my mind. It's not something that is stated. The details are still almost as if they happened yesterday. When Brynn was a toddler, just shy of 2, she had been having, so we had kind of a rough year with her. She'd had these sort of on and off fevers. They would last for 10 to 12 hours, and then they would go away 10 to 12 hours. And I could never really pinpoint. The pediatrician's like, oh, well, babies get sick. So she got really sick in the summer that she had just turned 2. And they diagnosed her with pyelonephritis, which is a kidney infection. And my pediatrician at the time decided to do some workup, and they discovered she had reflux in her ureteral kidney. So I guess that was bad news, but it was good news. It was manageable. It was something that happened. Kids outgrew it. They put her, they said, well, she'll probably need antibiotics for the next couple of years every day. Life was good. She healed. We moved on. But about a month after she was back to herself and taking these antibiotics every day, we were on vacation with our family. It was a big family vacation at the ocean, and she just was pretty irritable. And she had never really been an irritable baby. So then she got feverish. So I thought my first instinct was that she'd had, another kidney infection and the antibiotics weren't working. So I took her to an urgent care where we were, and they said, no, it wasn't a kidney infection, that it was probably just a virus, and sent us home. So she kept getting progressively more lethargic and irritable to the point where I just knew something wasn't right. So I packed up early and we came home on a Sunday, and I thought, well, I'll just take her to see my pediatrician in the morning, because there wasn't really anything glaringly wrong with her. So on that Sunday, I noticed that she just was a little harder to wake up and wasn't eating. So I took her to the emergency room. Well, actually, first I called my sister, because everybody in life should have a sister like mine. So I called my sister, and and at the time, ironically, I was an emergency room nurse, which may have explained why initially I was, a little more reluctant to maybe go into the emergency room, because, we see a lot. But I should have known then that if my instincts were telling me to go into the emergency room, then that was probably a big red flag that perhaps I was trying to talk myself out of. So we went into the emergency room on a Sunday afternoon, and she really wasn't feverish. She just wasn't acting right. And I tried to explain my story, and they ran another urine test. And I got worried because, she was 2 and she just didn't move when they cast her for the urine, when they put the tube in to get her urine.
For any of you who have had the unfortunate circumstance of having to be present while a urinary catheter is inserted into a toddler, you know it is one of the most difficult procedures for the parent and the child. The patient must be in an uncomfortable position, and between the harshness of the cold soap and the feeling of a catheter, the procedure is an unpleasant one. As a child life specialist who used to work in radiology and now in the emergency room, I can tell you I have been present for hundreds of these procedures. Being a support to parents and providing an alternative focus for these kiddos during this procedure is a top priority for me. So when Michelle says that her daughter didn't flinch when they placed the catheter, you know something isn't right.
And coincidentally, it wasn't the emergency room that I worked in. I went to the one that my pediatrician was associated with, just because it was closer to where I was. So they did her vital signs when we were in triage, and they were really abnormal. Like her heart rate was in the 200s, her blood pressure was like hypertensive, like 200 over 120. And the nurse had said to me, oh, well, it's just because she's a child, which didn't sit well with me as an ER nurse because she wasn't flailing. She was just kind of like a limp dish rag. So they kind of put it off. And then when the urine came back clear, I sort of had to push, and they did some blood work. And they're like, well, her blood work is fine. Her urine is fine. And I kept coming back to, but her vital signs are not fine. And they said, oh, well, with kids, they can get anxious and nervous, and sometimes it's not a good reading. But she was just kind of laying there. So I started, to be quite honest with you, we sort of got into a heated discussion with they brought the in-house pediatrician down to look at my daughter. And it was funny because outside the room, I had heard them saying, oh, she's just a crazy ER nurse mother.
I feel like this is one of those good teachable moments to remember that if you don't have anything nice to say, don't say anything at all.
Right. So they didn't know me from Adam. So I called my pediatrician on call. Luckily, she was on call, and she lived very close. And, we had been in there probably the better part of 6 or 7 hours. So it was closing in towards midnight now. And my pediatrician said to me, I'll be right there, which if you're in a career in healthcare, usually a private pediatrician does not come into the emergency room. So years later, I'll find out why. But, at that moment, I was just so thankful that she was coming in. So she came in at almost, hair was a little disheveled, and she took one look at my kid, and she kind of flipped out with me. She scooped her up, ran her to the CAT scan, came back, and did a spinal tap, and her spinal fluid was milky. So we knew she had an infection in her spinal cord that had obviously progressed far enough to her brain that now she was starting to go into respiratory failure, and her breathing patterns were changing. I feel like almost everything was against me that night except my pediatrician. So she tried to call the helicopter to fly her to the ICU, but the weather was bad. So they sent their ground transport. And when the ground transport arrived, one of the paramedics passed out.
What?
So she passed out in the ER from something.
Oh,
so they're like, well, we need people to transport. And my doctor saw what I saw, and that was that my daughter was really, she was going to go into complete respiratory failure. So she convinced them to let me be that third ride along since I was an emergency room nurse, and she got us to the hospital. And literally as we pulled in, Brynn started throwing up in the back of the ambulance, which is a sign of increased intracranial pressure.
Mm-hmm.
And literally as they got us into the ambulance, the ICU doctors met us in the ambulance bay, and they were intubating her before even getting to the ICU.
Intubation is a procedure by which a tube is inserted through the mouth down into the trachea, the large airway from the mouth to the lungs. This typically happens before surgery when a patient is undergoing deep sedation, or like in Brynn's case, during an emergency situation when the providers are concerned that the patient is unable to breathe on their own. So did you watch all of that happen?
I did. Yeah, I did. When she was through it, it's funny that what you know and what you don't know. I mean, when she threw up, that's when I thought I started to get nervous. And then when I could hear them bagging her in the back of the ambulance. They took her to the ICU, and she didn't even need, at this point, she was so, her mental status had degraded so severely that she didn't even need sedation on the vent. So, if you know anything about neuroscoring, they do a Glasgow. There's a scale, 1 to 15. 3 you get just for being human. You don't even have to be alive. And 15 is normal. And Brynn was a 3. She didn't respond to pain. She wasn't breathing on her own. So she was like a 3/4. The next few days, trying to figure out what was causing they couldn't isolate anything. They sent her spinal fluid to the lab again. They did another spinal tap. So that was 2. And then a few days later, they did a third to send off to the CDC because they could never isolate the virus or that was, attacking her brain. So she stayed. So it was hard. It was hard in the ICU because nobody could tell me anything. Nobody could tell me, if she could, if she was going to live or die. And at that time, the internet wasn't nearly as robust. I know we all laugh about going to the internet, but, sometimes, you can really find great resources. Well, that really wasn't a resource for us back, almost 2 decades ago. So the prognosis, basically, they told me that maybe 50-50 she would live. And if she did, that usually it had really bad outcome, meaning that you have suffered some sort of permanent disability from it, whether that be, cognitive or physical. Nobody could tell me anything other than we're going to try to keep her alive and hope she wakes up, really was where we were at. And so...
So were you by yourself at this point, or was your husband able to come? Was your sister able to come and be with you as you're getting all this news and trying to filter through it all?
Yeah, luckily, I think I had such an amazing support system. So I had my family. My sister was there with me. My sisters took turns. My nurse friends coordinated a schedule so that they didn't overwhelm me, but somebody would come like every 4 or 5 hours and, just bring me a little something. I remember, I still laugh with one of my best friends. She asked me what I wanted, and for some crazy reason, I asked for Noxzema. I don't really use Noxzema, right? I think I used it as a teenager.
Wow.
Right? Isn't that funny? And we still joke about that till this day, that she said it took her like 4 places until she finally found Noxzema. So I felt, yeah. But you know what? It's so funny because I used it the entire time I was there, and now it's like a trigger for me if I smell.
I'm sure.
Noxzema.
That is hysterical.
Isn't that funny? It's the most random things that you buy. But, the nice thing was, one of the things that comforted me the most was that, the staff encouraged me to leave, but I couldn't, even though there was a Ronald McDonald House. I just couldn't leave because I don't think we had any answers. And I was afraid I was going to miss something. So I was having trouble closing my eyes because I just felt I just needed somebody to watch her. And so I was very fortunate in the fact that my dad was retired. He would come up at 11 o'clock at night, and he would sit in the rocking chair, and he would stay up all night so that I could sleep.
Oh, my wow.
And yeah, and it's funny because he and Brynn always had I just lost him about 1.5 years ago, but the two of them had a really special bond. And he would sing her Irish lullabies, and he would talk to her. I'm convinced that Brynn is headed off to a career. She's trying to decide. She has 2 appointments. You can go to the Air Force Academy or the Coast Guard Academy. And I think it was my dad all those years ago talking to her because he was in the military.
Yeah.
But yeah, so that support system was, I think, a lifeline. And some of the advice that I got, I was fortunate in the fact that one of the ICU nurses was my neighbor and friend, and she gave me some, really good advice. And at the time, I thought it was kind of crazy. She said, you need to take pictures because one day you're going to want to remember this good, or, you're going to want to have this. And I'm like, why would I want to take pictures of this, And I just thought that was terrible. But I did. And it was probably, I never looked at him for 10 years. 10 years I couldn't look at him. And then I looked at him but put him away because they made me cry. And then it was so funny because when Brynn turned 18, I pulled them out and I finally showed them to her.
She had never seen them before, or did she know the story at all?
Well, she did know the story because she had years. So she had years of recovery that she had to go through. So after about 8 days, they wanted to it's funny, they wanted to trach her, so to put a breathing tube in because she wasn't waking up. And I fought them and I said no. And it was kind of funny because my mom, I my mom is very Catholic and my aunts were very Catholic, and they were visiting, and they asked if they could bring their priest to visit. And I said, absolutely. It was, to me, things like that. It's supportive because my parents were going through it too. And that's something I think that when you have a kid who is critically ill, sometimes you get so obsessed with your journey and your child's journey that you forget that there are other people suffering around you. And so when my mom asked that question, I could see that she needed that. So it was funny because they had just, we had just had this discussion with the doctor about I didn't want her to have a tracheostomy. And so the priest waited outside, and then he came in and he prayed with my mom. And while they were praying over her, it was the first time that Brynn actually moved. So, and then it was a slow recovery after that. And it was hard.
So, had she still not been on any of those sedatives or anything
Nothing,
like that during that time?
nothing,
Wow.
nothing. She was on a ventilator in a coma without response for 9 days. So,
were you in the room when they were doing that prayer? Were you right next to Bryn when it happened, or did you like scream for the nurse or the doctor to come in? What happened?
well, it was funny because they were getting ready to pack her up. She was going for an MRI, and so there were people in the room, and they did not have. You know how usually you have kids tied, or people on ventilators, their arms are secured so they can't pull their tube out.
Mm-hmm.
Well, Bryn's weren't because she wasn't moving.
Right.
So,
No restraints or anything.
right. So they were holding her hands, and at first I thought maybe it was just somebody had bumped the bed, because there was a lot of motion in the room. Got quiet and still, and the priest was still praying, and Brynn went to try to reach, like reflexively reach for that tube, even though she didn't open her eyes. And then they took her off to MRI, and she came back, and she didn't move she was, quiet again. But I think it was I know it was the first time she started to wake up. So it's funny because my mom, that's what my mom remembers. Everybody remembers something.
Mm-hmm.
Like I remember, the crazy things like Noxzema. My mom remembers that very clearly. That's the first time that the priest came. And, I wasn't very religious at the time, but,
Yeah, I would have hugged that priest.
yeah,
I would have.
he came every day.
uh,
Yeah, and I remember it was hard because I had to walk the line with being an advocate because, they did want to trach her, and maybe medically that was the right thing to do because that's what the textbook said. But it was something in my gut telling me, no, don't do that. And so that was really hard, finding my strength putting my nurse hat back on. I know how terrible those were. So I negotiated. I was a negotiator while she was there. Because I guess I thought my attitude was, well, if she's not going to wake up, what's the rush? I think, and I know that's kind of a really somber thought, but I think I held out hope that she was going to wake up, and I didn't want her to have this big, nasty scar. And they couldn't tell me that she wasn't going to wake up. So I guess, once I had sort of told them why I was thinking what I was thinking, they became a little bit, they sort of backed off a little because they were pretty aggressive in wanting to put one in.
yeah, I was about to ask how receptive they were to you. Given that you were a nurse, do you think that they listened to you a little bit more than maybe they would have someone else?
I think it went both ways. I think they listened to me more because I could speak their language. But I also think they were very resistant because they thought that maybe I perhaps thought I knew too much.
Quote unquote, they know too much.
Right.
Yeah. I feel like we hear that a lot in the medical field. You know too much. I know too much. I feel like I say it a lot.
We do. And I think they're right. I mean, in all honesty, I think that's a very fair assessment. She woke up. It was a rough wake up, but
was it slow for her, or did they want to sedate her again, or did they immediately get the tube out?
no, they didn't sedate her at all. So because she would just sort of have these periods for about the next day and a half where she would just get a little restless. So they started doing weaning trials on her where they would see if she could breathe above the vent. And when she got to the point where she could breathe above the vent, then they pulled it out. But then she struggled, and they had to use a helium oxygen mix for 24 hours.
I'd like to share with you all what Brynn's official diagnosis was. It's called meningoencephalitis. According to the Mayo Clinic, meningoencephalitis is rare, with under 200,000 occurrences each year. It is typically caused by a virus, bacterium, parasite, or other microorganism. Symptoms vary depending on the cause, but can include fever, confusion, vomiting, seizures, and if left untreated, death. Treatment includes antibiotics, antivirals, or supportive care, depending on the origin of the disease.
Then it got really hard because she didn't wake up like she was my child anymore. She was very confused with like a head injury. What we didn't realize, it was funny because the entire time they had an infectious disease doctor treating her. And, he was sort of an institution there. Everybody knew him, been there forever. He came into her room after she woke up, and I was actually very stressed because she was very irritable and inconsolable, and we didn't know what basically was going to happen as far as, what did the virus do to her brain? What did it do to her body? And so the infectious disease doctor came in, and he sat and he looked at me. He was a very academic kind of guy and was talking, and then he stood up and he dropped metal floor, and Brynn didn't even flinch. And I was like, what's he doing? Like, I couldn't figure out what he was doing. Well, what he was doing and what nobody else realized was Brynn had lost her hearing. So he said that he was watching her, and because she didn't turn to hear the noise and hear him, so he was the one that discovered she had hearing loss. The infectious disease doctor. Isn't that ironic? So after they took the tube out, Brynn didn't sleep for 48 hours. And so I remember fighting with the resident because not only was she wouldn't sleep, but anytime they took her out of my arms, she became almost like she would start thrashing and a temper tantrum. But as soon as I would hold her, she would calm back down. So I remember like on hour 18, my sister and I going into the bathroom, and I literally couldn't put her down. And my sister helping me to the bathroom, my sister was feeding me. We got in the shower together on day 2, and then finally, and I was trying to sleep with her in my arms with somebody watching, and I said to the resident who was being, the resident was a little insensitive. He's like, just put her down and she'll fall asleep. I remember thinking, I'm laying in the bed with her and she's not falling asleep. And I think because nobody understood what was going on, it wasn't like there was no template for this. There was no, we know what's going to happen, this is normal. It kind of had everybody baffled. And I asked to give her something to sleep. I'm like, my goodness, this kid's been up for 48 hours. I had been up for 48 hours, and I was ready to fall apart. And I remember the resident saying something to the effect, well, she's, basically slept for 8 days. Of course she's going to be awake, or something like that. And I remember thinking, wow. About 4 months later, I went back to speak with the director about the fact that somebody like that didn't belong in pediatrics. And so they finally gave her something to help her sleep. They called neurology in, and neurology's like, yeah, this kid needs to sleep. So she lost the ability to hear. She lost the ability to walk. She couldn't swallow, and was very confused, would get caught in a loop on a word. So she would say, I remember she liked this video, Spot. Remember the dog Spot?
Mm-hmm.
And she would watch it and she would just go, Spot, Spot. And that was the only word she could say. And so it was kind of uncharted territory because I think the worst part of all of it was nobody could tell me, in 3 months, like a broken leg, you kind of know sort of the progression of how things are going to heal, or what the complications are going to be. And with this, I just got blank stares. It was just, well, go figure it out. Go, take your baby home. And yeah, what, staying in the hospital. So they sent, me home with my baby
Oh,
who
jeez.
who couldn't walk and who couldn't speak, and her swallow stuff
Couldn't hear you.
couldn't
Yeah.
hear me, right? Nobody could tell me anything. But the one bright shining star in all of this was the pediatrician who came into the emergency room, who ironically was a Navy doctor. And I think this was Brynn's destiny to go into the military. She was my sort of my beacon in all of it, because she just knew what, like, she was very proactive. So I often think it's funny. I often think there are people who go into medicine because, oh, I want to be a doctor, and then there are people who go into medicine because they want to take care of people. And she was definitely one of those who wanted to take care of people. So when I got home, she made it a point to call me kind of every night and say, okay, how'd your day go? And I think that's really what got me through it all, because, what do? You took this perfectly normal child into the hospital, and now you've brought home this, this child who's been broken, and you have to put her back together again. So she definitely was sort of my clarity in all of it. And anything I bounced off of Brynn, she never thought I was crazy. I bounced off of her about Brynn. So, like, for instance, about 6 months later, Brynn developed really horrible body odor. And, when your 3-year-old smells like a sewer, you're thinking, what's wrong? And so she guided me through the medical process and never once made me feel that I was overreacting. She said, this is a unique situation. You have to trust. She trusted me. And I think that's what kept me from falling apart.
That's
because
incredible.
somebody trusted me. And that because she's like, who knows her better than you, Michelle? That's what she would say to me.
I bet seeing her as a pediatrician, and Michelle, you're already such a caring nurse, but I bet she even more wanted you to continue doing what you do.
Yeah, she did. She did. What the most beautiful part of the story is? So every year Brynn would go in and, have her physical, and, her and Brynn had this fierce bond, and she would say, Brynn, you're the reason why I became a doctor. And she, through the years, she would watch Brynn grow. So Brynn got her hearing back, and we talked, we rehabbed Brynn to the point where, she became a top level athlete. And
yeah, I will talk to us a little bit about, I guess, how long did it take for you once she came home and you were kind of, nursing her back to health and getting her involved in therapies? How long until you could finally, I guess, exhale?
Probably, I would probably say 5 years.
Wow.
It was 5 years, because I remember, I remember when Brynn finally turned 10, I was able to sleep through the night, because I would get up every night and go down and check on her. And it's funny, because I had 2 babies after Brynn, so I wasn't worried about them. I was worried about it. So, but yeah, it was 5 years of really intense rehab, and that, again, where my support system came in, because, I had friends, they're like, put her in swimming. So I had a swim coach, a friend who would take her to swimming while I was home with my other 2 kids, because people want to help. They're like, how can we help you? And I'm like, if you could just take Brynn to swim class, that would be great. And so she signed up her son and Brynn, and off to swim class they went, and she would take, Brynn, who was dragging her leg behind her, because she dragged her leg behind her for a long time.
Wow.
And, my other neighbor's like, well, I'm putting my kids in ballet. Can I take Brynn with me? And so we put her in ballet. And so we put her in all of these different things, even though, she'd fall down. Mm-hmm. They would just pick her back up again. And so I thank those people, because I don't know if I would have had enough energy and strength,
right,
to because I was, I had to go back to work, so I was working as well. And so those were things that really helped me along the way, was when people didn't ask me what they could do for me, they told me what they were going to do for me.
Right. They just did it.
They just did it. Mm-hmm. Yeah, mm-hmm. They just did it. And so, yeah, so probably I would say it was 5 years. I couldn't even talk about it without crying, literally, without sobbing. for 5 years, and then 5 years I could get through it. And it's probably, it's been, you know, 16 years now,
Wow.
and I can speak about it without it's so Brynn and I, it's so funny when she was writing her college essays, I told her about her journey and she knew because she would have way more doctor's appointments than any other kid on a, healthy kid. Kids that are sick tend to know how, know what ultrasounds are and MRIs. And
right.
so when it came time for college essays, Brynn wrote this essay that actually made me cry. But she said that, she's a really good athlete. And when I used to watch her, sometimes she would get frustrated if her team didn't win or, the season didn't go the way she wanted. And what I would always say to her through the years was, it's okay, Brynn, because you can walk. I said, for me, the fact that you can walk on the court, I said, that's my victory. And I just happened to say that through all those years.
Right.
And so she wrote an essay about the fact that now she can walk, now she wants to learn how to fly. Wow. So,
that gives me chills.
Yeah, right. And so, it's funny because I just never thought we wouldn't stop moving forward. So I never stopped moving forward. I guess I just never, I thought, well, you're going to walk again. And you're going to, but it's, the bittersweet part of the story is that Brynn had to get a medical clearance to go into the military, right? Or she's going into one of the academies. She made an appointment to get the forms filled out and had to make a last-minute appointment at the pediatrician. So she went in, and I had to go in with her. And her doctor was there. Her name was Dr. Diane Dubinsky, that saved her all those years ago.
And this is the doctor.
This is
the one.
She is the one.
Okay.
We sat in there, and I said, this is probably going to be the last time you take care of Brynn, right? And my heart was like, I was choking back the tears. And she says, that's kind of poetic justice. She says, because today's my last day of being a doctor.
Oh, my.
She retired on the day that Brynn saw her pediatrician. That was the last time Brynn was going to the pediatrician. She turned 18. She's going to be off either, doing something. And so her last day was Brynn's last day. So we cried. We cried probably for an hour. And she says of all of her triumphs and, everything she's been through over the years, she says, Brynn is definitely her miracle baby. And that, she said she learned more about being a doctor taking care of Brynn than she did, with everybody else. So it was really important for me through my journey that I have somebody like that. And,
And what made her such a good doctor was trusting in you, really.
I think so.
And listening to you.
And it's so funny because I asked her, so on that last day, I said to her, she said, I said, I've had this question all these years that I've always been afraid to ask you. She says, you can ask me anything. I said, I said, what was it that made you come into the emergency room all those years ago? Because, pediatricians don't do that. House doctors are there. I said, I said, I don't understand. I said, everybody was telling me I was crazy. I said, what was it? And she said, honestly, she said, when you told me, she says, the words that a mother will say, something is wrong with my child. She says, you got really quiet and you said, something is wrong. And she says, and when I hear those words, and she goes, it's just something that, she says, because I've only gone into the ER maybe a handful of times in my career. She goes, I could probably count on my hands the number of times. And she goes, every single time, she says, the mother has said, something is wrong with my baby. So, and I remember saying those words. I couldn't articulate what was wrong with her. There's something wrong. And it's so funny. She says, because parents just don't say that. Usually they'll say, oh, she's got a bellyache or this or that. They can, but when they can't articulate it, she said that it really causes me concern.
Well, Michelle, if you could give any advice to someone who's going through a similar situation that you were in 16 years ago, what would you tell them?
I would tell them a couple of things. I would tell them it's okay to wear your crazy hat. That's like your badge of honor. I would rather be crazy than wrong. So, and that, that hurts. I mean, sometimes that really hurts when they tell you. I would also tell people that, your medical care team, it's kind of like that you should pick them with this more care than you pick the clothes in your closet. I mean, if you think about, we try on jeans and we put a lot of time and effort into picking out cars and houses and clothes, but sometimes with medical professionals, we don't demand that. We just show up and, take it. And I think what I have found along my way is if you don't click with somebody and it's not somebody you look forward to going and seeing, you have the permission to move along. Because Brynn specialists were scattered. We're very lucky to live in an area where we have, several really good hospitals. So she had doctors at all of them because I needed to find the right ones for her. And, that's something that I think some people get afraid of. And then let people help. Let people, don't think that, I know that's hard, but just tell people just to help, even if it's just your grass or, people want to feel helpful and make your life easier. And sometimes it's, hard to ask for that help. So I know that I think all those years ago, if I would have just said, somebody, could you come, stay up all night so I can sleep? So that's my advice. Wear your crazy hat, find the right team, and give yourself permission for help.
I'm thinking back to just a few years ago when Brynn had a little bit of a situation and,
Yep.
Working as a child life specialist with you, but also being your friend and, now knowing this story, how difficult any cold must have been, how difficult any fever must have been. You must have just felt all of it all of the time.
Well, it's funny, and I don't know if you know the sort of the outcome of all of that, but that too was a time when a doctor told me I was crazy.
I do remember.
You remember?
I do.
So she was flat on her, and they told me I was crazy, and I think I learned my lesson, and something was wrong with my baby, and I didn't give up. I got an answer. We got an answer that, she definitely has, a connective tissue disorder that pieces all of this craziness together.
Right.
And it's not something that's well understood. And, Brynn and I have decided that since it's not well understood and there's no treatment, that we're just going to table it. It sort of lives there on the shelf. Like we know it's there, but we don't live in it. But it was funny because you watched, a very prominent, very strong-willed physician try to tell me I was crazy. And I'm like, no, I've done this before. I'm not crazy. Something's wrong with my baby.
Yeah, exactly.
So,
and you persisted and you trusted your instincts and yourself, and you have to when you're a mom.
You do.
That's our job.
It is our job. And you have to listen to that little voice because you got to trust that you know your kid better than anybody. And so somebody who looks at your child for 5 minutes versus every day of every year, every second, just because you're not medically trained doesn't mean you don't know your child. So
I love that advice about really finding that medical professional that will listen to you and trust you. And I feel like if you're in an emergent situation and you're surrounded by people, usually if you don't trust one person, you can find someone you do trust. And I feel like connect with that one person. I don't feel like,
absolutely.
I just don't want people to feel like they have to go in and then, literally move locations, but just find one person you can trust and you can be real with. And usually they can help advocate for you.
Absolutely. Which was my pediatrician was, definitely somebody who really, I think was my she was my grand central station. So, I think that, well, and I also think if you set the expectation of, I think sometimes we lose sight of the fact that children hear everything we say, whether we think they're processing it or not. So if there's a tense relationship between you and the provider, they pick up on that. I mean, it would be like they would pick up on a tense relationship between you and a teacher, or you and a server, or any other profession. And so you're going to teach them. So Brynn was never, with everything that she had to go through, the lab work, the tests, she always took it with beauty and grace, because she knew that we had that person in our corner that, sort of was helping steer our ship. Whereas I think if that was a tense relationship, I'm not so sure things it could have been worse. And sometimes I think providers are human. And if you explain to them that you're right, you just need to be open.
So I have a really tough question for you. If you could sum up this experience with Brynn in one word or phrase, what would it be?
I would say tenacity. I think that's what it is. It's tenacity. You can't. You just have to hang in. So, yes, there were tears. Yes, there was all kind of emotions. But I think looking back, it was just, that would be my one word that I would use.
For you and for her. I see that.
Yeah. Mm-hmm. It was. And, and you get tenacity from everything, from the people, you just don't realize what you got in you.
Michelle gave some great advice. Advice in my book that is worth writing down. 1, it's okay to wear your crazy hat. 2, take time in finding your child's medical team, and if you don't click, it's okay to move along and find someone else. And 3, let people help. If you would like to connect with Michelle, and she has said that she is more than willing to connect to offer advice, comfort, or support. In fact, she's already done so in the past with friends and acquaintances who have had children with encephalitis. You can do so via Facebook or her email, both of which I link to in this show notes page. Stay tuned for a quick preview of next week's episode at the end of these announcements. Thank you so much for tuning in to the Child Life On Call podcast. A big thank you goes to Barbara Riddle Photography for donating her time and incredible skills as a photographer to take the beautiful picture of Michelle and Brynn for this podcast. If you haven't already, go check out the picture on our Instagram account and then go follow Barbara Riddle Photography on Instagram or Facebook. Please like our Facebook page and follow us along on Twitter or Instagram. If you would like to share your story or have questions about this podcast, you can email info@childlifepodcast.com or submit your information to our website, childlifepodcast.com.
He told me after, he said, I have to tell women. I've seen women go into postpartum depression immediately. I've seen, when you have no knowledge of that there's anything wrong, and suddenly your kid is born and there's something wrong, and they're not, the perfect child you envisioned. He said sometimes, it's too much. It's overwhelming. And and he said, it's my duty to kind of talk to you first. And I said, that's fine. I wasn't upset or anything. I said, that's fine. I just want to hold him.
You just heard a preview of next week's episode from Kim, mom, teacher, and blogger extraordinaire. She will talk about her son's surprising diagnosis shortly after birth and what their journey has been like since that day. You won't want to miss it, so check back next Monday.